Hello, I'm joined by Dr. Mark Pickering, the Chief Executive of the Christian Medical Fellowship, and I know you're a GP as well yourself, Dr. Mark. So
that's right.
Thank you for stopping to speak with us today.
You're very welcome.
We are remembering 58 years of legalised abortion, and certainly in more recent years we've really seen it not just branded as healthcare, but branded as essential healthcare.
Yeah.
How does that feel and how does that sound to someone like yourself as a doctor?
It feels incredibly sad for me as a doctor, and you think of the millions of unborn lives that have been lost to abortion. And when the Abortion Act was passed in 1967, everyone was saying this is just for a small number of hard cases, and okay, you can make some argument about what's the best thing to do there, but nobody really envisaged what we have today when human life is entirely disposable, and its value depends completely on whether the mother wants to keep it or not, and we don't think of anything else in those ways generally. So I think it's really terrible that we've got to this situation. I think it's terrible that abortion is being branded as essential healthcare. There's no other healthcare procedure hardly where success means the ending of another life.
Exactly.
And I think that's it's a very sad place that we're in this country.
And more recently, of course, we've seen a lot of MPs voting for what is called decriminalisation of abortion, but we know will mean abortion up till birth. Again, the abortion are getting even more liberal, as if 250,000 a year isn't enough.
Yes, and I think, whilst that decriminalisation for women would, in theory, allow abortion up to birth, it's going to be very small numbers in that situation, but it's still, I think, very shocking the way that it's been done. You compare the level of debate that we've had and scrutiny about the assisted dying bill, hours and hours and hours of really careful debate from both sides, and I think this was rushed through in 45 minutes within the House of Commons, and there was hardly any notice of it. So I really hope the House of Lords will scrutinise that much better. And I've been struck by many people who've been quite shocked by what happened there in the House of Commons. And people have said to me, well, I'm pro-choice, but this is really, shocking that this is happening. And I think that idea of pro-choice but is something that we really need to think carefully about. There are so many people who wouldn't want to restrict the law too much on abortion, but they're really shocked and surprised and dismayed by the way that the abortion lobby has just pushed this through, like you say, as if it's essential healthcare. So I'm really hoping that this will be the beginning of a change in society, when we'll start to see that actually the abortion lobby is not out really there for women's the good of women, or certainly not the good of unborn children, but actually for an ideological position that is quite disturbing to many normal people. Yeah.
Lastly, Dr. Mark, I happened to read this week that I think St. Peter's Hospital in Croatia, they've had so many doctors and medics that have refused to take part in abortion. They've actually had to suspend abortions at that hospital. Okay. And I thought that's something really encouraging for us to hear in this country, that doctors, that medics, nurses, midwives can say no to abortion, and it's really important to know that, isn't it?
Absolutely. Conscience rights have been enshrined within the Abortion Act ever since it was enacted, and sometimes that's quite narrow about actually doing the procedure itself. Nobody in this country would be forced to perform an abortion. It's a little grayer around if you're writing a recommendation or prescribing a medication that would start an abortion or that sort of thing. But yes, people can say no, and I think I would definitely encourage healthcare workers, to exercise those rights. And even if it's a little bit grey and a manager says no, you have to, it's all right to stand your ground. Yeah. And if you want legal advice, there are people like Christian Institute, the Christian Legal Centre, ADF International, be really happy to help you. I know you've been really well supported legally for praying inside the abortion buffer zones, and that's been really good to clarify that. And I think what I would really want to see, my prayer on this day of prayer, is that we will see a new generation of healthcare workers who will actually support life, value life, stand up for life.
Absolutely.
And even if we have continue to have a framework where abortion is legal, we could see the numbers far, far lower if women had real choice, if they were actually supported to make a choice for life, and if we had healthcare workers, church leaders who were not just informed but able to speak compassionately but with courage to present a different view. So I really hope that what's happening in Parliament now will be one of the first steps to really change things and see a better direction.
I hope so too. And I always say to people who are going into healthcare, make sure that you don't even get the tips of your fingers dirty, and that's just so important for all of us to hear, whatever walk of life we're in. So thank you for the witness that you give and the work that you give, Dr. Mark. Thank you.
Thank you, and you too.